everybody, it's Dr. Jo and Dr. Jen, and today we're going to talk about diastasis recti. So let's get started. Disclaimer alert, disclaimer alert. So today I have Dr. Jen with me, and she is a specialist in the pelvic floor and also happens to be pregnant, so she's super special. So Dr. Jen, tell us a little bit about what you do.
Just as Jo was saying, I'm a pelvic floor physical therapist, so I treat pain, weakness, discomfort, difficulty performing ADLs, or activities of daily living, primarily with things like bowel, bladder, and sexual dysfunction. That's across the whole spectrum, men, women, and children, and it includes the pre- and postpartum population. So today, we're going to talk about what happens after pregnancy when your belly has been stretched out for almost 9 months. It's called a diastasis or
diastasis.
Either one.
Whatever you want to call
it. Tomato. Regardless, it's the same thing. Diastasis is a midline separation of your rectus abdominis or your six-pack muscles. As you can see, rectus abdominis generally lives parallel to one another in the non-pregnant population. But as our belly expands, those two muscles start to separate. After you deliver, you may notice a slight bulge in the middle of your abdomen, a separation between those two that was not there. That is totally common. However, it should resolve in about 4 to 6 weeks, and most women don't even have to think about it. But what if you are one of those women who experience a bulge when you're getting up out of a chair or noticing that you're trying to get back into your workout routine and all of a sudden things just don't feel or look the same?
Right.
My first piece of advice is at your 6-week checkup with your doctor, talk to him about it. Say, hey, what is this? Something feels different, something looks different. And as long as you have the clearance from them, from a pain perspective, I think you should go ahead and start self-treating or seeing a physical therapist who can help you strengthen your abs correctly.
And on a side note, this is something that men can have as well, right?
It's a really great point. I apologize. Yes.
No, I just in general, because I have had people ask me, if you are a man and you happen to have a little bit of that beer belly, that can also cause this as well. So men or women can have this.
Such a great point. So yes, if you are a middle-aged man who loves your beer and your belly's up to here, you can actually fix your abs too.
All right. So you going to show me how to do it?
I am.
Okay.
I am. So the biggest problem that I see is most people have this midline separation. They know it's coming from those six-pack muscles and they decide, well, I'm just going to do a ton of crunches. And what happens is you're trying to strengthen in a really poor position. Your abs are kind of stretched out and then you're tightening in that range. And to be quite honest, you're generally making things a little bit worse. So I want to show you how to accurately perform a diastasis correction. And for those new moms, it's a great opportunity for you to get on your floor with your baby. You can grab their swaddle and you can self-correct in a few easy steps. Cool. So I'm going to have Dr. Jo be our model because this is Dr. Jo postpartum.
Right.
Try not to fix your diastasis during pregnancy.
Correct.
Okay. I'm going to have Dr. Jo lay on her back comfortably. Okay. Knees bent, feet flat. And I'm going to find a swaddle, a blanket, a pillowcase, or something where I can just grab the two ends of that because this is going to help pull our muscles into a good position. This is going to go right behind Dr. Jo's back, under her belly button, okay, right at midline.
Okay.
And then whenever you're ready, go ahead and lie back down.
All right.
The first thing you might be asking is, how do I know if I have a diastasis? I feel weak. So there is a way for you to check this, and we can do that easily while Jo is here. I'm actually going to lift up her top shirt. Again, this is a midline separation. So right at your belly button, you can just place one finger at your belly button, apply gentle downward pressure, and do a really small sit-up. So lift your shoulders up for me. Jo has absolutely no separation. I can't even fit one finger in there. Go ahead and lie back down. But what you might find if you have a baby, as you lift up, you may either see that visible bulge, or you might be able to fit 2, maybe even 3 fingers in that space between. So that's the first step is, do I have a diastasis? If so, you talk to your doctor, and as long as you're cleared, you can start some of these exercises. The next step is figuring out how to activate your abs in the right position. So we have Jo in the proper position on her back. with a pillowcase or whatever you're using to help approximate or pull those abs into a good position. With Dr. Jo's left hand, she's going to grab the right side of the blanket, and then she'll reach across or under and grab the other side of the blanket. We want to do our crunches or our core strengthening with your rectus abdominis lined up, or what we call approximated. So step one, Dr. Jo, this is a little tight, not uncomfortable.
Okay.
Go ahead and pull the two sides of the blanket together, aligning those two six-pack muscles. If you have a little bit of excess skin postpartum, you might find that that bunches. That's completely fine. We just want your six-pack muscles to come together. So step one's completed. The next is to activate your deep core. So we want some good stability. So I want Dr. Jo to just gently pull her abdominal muscles in as if she's tightening her inner corset. Sometimes that looks like a very small pelvic tilt, but she's activating her deep core. And then the third step is to bring on the six-pack muscles. So just subtly, Dr. Jo, lift your chest up towards the ceiling as well as your shoulders, and then come back down. The last piece to this puzzle is making sure that you're exhaling with every effort, okay? So you inhale, exhale, abs come in, pull tight, lift, breathe out, and come back down. Perfect.
Woo!
I know. It's a little challenging. There's a lot to think through, and this isn't just muscle retraining. This is brain retraining. So we're getting our deep core firing to give that stability first. Then we're getting our muscles in a good position. Lastly, she's lifting up her head and her shoulders to activate rectus abdominis and come back down. This should be completely pain-free. If you're lifting and it's uncomfortable, I would seek help from a specialist. If this is pain-free and you feel those six-pack muscles working, I would work my way up from 25 to 50 repetitions about once or twice a day. Always making sure that you're breathing out. The big kicker here is after you have a baby, you want to be very, very cautious of your bottom or your pelvic floor. So when I say exhale with every effort, we're doing that to prevent excessive pressure from pushing down and causing any sort of trauma, discomfort, or any other further symptoms.
Excellent.
That's it.
Do you recommend resetting every time?
I think that's a really great point. Initially, for those patients who may be a little out of shape or just feeling a little bit of tightness or trying to get in the hang of things, absolutely reset between every one. Mastering that contraction of the abs or the deep core with the abs and coming back down. As you're getting stronger, you'll find you're able to do 10, 15, 20, still breathing and not really feeling a ton of fatigue. But I think it is better to start a little bit slower.
Awesome.
Yeah.
All right.
Easy peasy.
Easy peasy.
So men, women, if you want to get rid of that midline bulge, this is an easy way to do it as long as it's pain-free.
Excellent.
Cool.
So there you have it. If you'd like to help support my channel, make sure and click on the link on the other side of Dr. Jen. And don't forget to subscribe by clicking down there. And remember, be safe, keep everything together,
And have fun.
have fun, and I hope you feel better soon.